birthing complications. So it's a very interesting topic, and I think it needs to be talked about more.
Acknowledged.
Yeah,
yes.
acknowledged.
And even like with females, like female circumcision was still covered under the American Red Cross until the 1970s.
Yeah.
It's not too far from that.
Yeah.
No, it still happens in some countries.
Yeah.
And I walk a fine line because I had a friend once who was really a proponent of it, that was part of her culture, and I was very anti female genital cutting, but I also really respected what she was saying and really wanted to hear it. Like, this is part of my culture. This is who I want to identify to my ancestors. So this is what I choose to do. I am choosing this. So, so I have to really take it in the context of who I'm speaking with, and also,
It's a really great question.
Yeah.
I'm sure we could definitely keep going for the sake of time as well. Do you still have a question that you want to ask?
Yeah,
Okay.
so because sexual health is just there's so many components
Yes.
that it's composed of, as you guys mentioned. How do you go about educating your patients or people you work with as far as enriching the education in revolving around sex? Because I feel like that within itself is so minimal in general. So I guess more specifically, any practices, exercises, examples of things that you implement or do.
Maybe we'll start with Tori.
Or
we don't have to.
No, yeah, I think actually, let me think about that. Because I kind of cover a 3-hour lecture on that with my students in the spring, right? So I'm like, oh my God, where do I even start? So if you want to start with that one, I'll think about how to have a teeny bit of information.
Right. So being a massage therapist, I'm teaching couples massage. I'm not in a OB clinic, and I'm not an occupational therapist, right? So it comes up very casually, and generally people are, quite frankly, already naked on my table, and so they already trust me. So, but it is first about making them comfortable and asking them the questions about themselves, asking them a little bit about their history without being too invasive, maybe what their religion is, or how they were raised, so that you can be completely non-judgmental and open and accepting and understand where their boundaries are and where they're comfortable, and then go from there. For me, I teach, again, a lot of Taoist techniques, cultivation exercises, something called the microcosmic orbit. And this is an exercise that starts at the perineum. For women, it starts at the ovaries. You bring the energy down to the perineum, up the spine, to the front of the mouth here where yang turns to yin. This is your bubbling well, right? So the sexual energy is raw, hot, carnal energy. You don't want to dump that on your organs, right? So here is where yang meets yin and mixes, right? This is a cooling, and that heat rises and then cools, and it's like a waterfall that nourishes the organs. So I teach meditation. I teach cultivation exercises. I give them as many tools as I can. There's something called the jade egg exercise, and this is an egg that you put inside yourself, and you learn to squeeze and move and manipulate. And one of my mentors, Marcia Kerwich, she's dead now, she was 80 years old. She would take that egg and a piece of dental floss and lift an 8-pound weight off the floor at 80 years old. So this is empowerment. Yeah. So you speak very gently, very sensitively, but very quickly people get comfortable and you start getting really intense and really deep. Yeah. And they're ready. They've been waiting for somebody like you to come along, you know. So it's very sensitive in the beginning, very sensitive, very respectful, very non-judgmental. And again, ask them as much questions about themselves as you can. You know, when did you have sex first? What was it like? How old was the person you first had intimacy with? What is intimacy to you? All of these things to get yourself really informed Because it's likely that if they're having a sexual issue, they're also having a mental issue or an emotional issue with that. And so we really have to look at the whole spectrum again and really be so sensitive and caring and ultimate compassion and non-judgment.
That's great. Tori, it looks like you've been writing.
Right? Yes. So my understanding of the question is how it enhance the interaction. Is that a correct interpretation of the question? How to work with our clients to
Yeah.
enhance their experience?
Yeah, to enhance their experience, to empower them,
Sure.
to like just broaden their education,
Education.
of themselves.
Yeah, so I think the first thing is communication, and communication with them, and as well as if they're talking about interactions with another person, how to enhance their communication with that person. So maybe they're really uncomfortable talking about specific acts or specific body functions with their partner, so like role playing that conversation with, could that be like, or coming up with analogies or words. And one thing that really comes to mind is like somebody who has colostomy and wanting to be sexually active again. And colostomies have noises and sometimes odor, and there's a lot of stuff around colostomies, right?
Could
So.
you maybe explain what
A colostomy is an incision, and so then usually you have a bag that collects fecal matter. And so there are people with colostomies can be extremely sexually active in a lot of different ways that we would think of as sex. And so communication is a really huge thing. Education, I am perfectly fine having somebody ask me questions and handing them 10 websites and saying, here's your comfort level right now, come back with you if you have more questions, because that allows them to move at their own pace. Or if they're like, well, can we look at one of them right now together? Yeah, absolutely, let's go ahead and pull up one of these educational resources online, and then they can have questions right there. We have some amazing local resources for learning about sexual health. Shebop is one of them. It's a local boutique. They've got a place on Division and one on Mississippi, and I know I have nothing coming back to me for saying that, but they're an amazing resource. And we have a lot of other organizations. The Q Center has some fabulous information and educational sessions around different types of lifestyles, as well as different types of preferences, and how to have different conversations. So I think conversation and education, also education around the normal aging process and things that can happen, because I think we all probably have clients that come in and say, wait a minute, and I know we've been saying a lot about women's health, but men come in and say, I'm having difficulty maintaining an erection, this was never a problem, wait, what? Oh, you have diabetes and you have high blood pressure, have you ever tried a cock ring? And I mean, this is one of the things that I think about, because in the morning there's this natural reaction that they have an erection, and hey, use a cock ring and probably you'll be able to maintain your erection in order to carry out that activity. Again, that's with the assumption that they want some kind of penetrative activity happening. So I think, and those are just examples. I could go on, but I'm not going to. Education and communication.
The education piece for me is a lot of working on misconceptions. Some examples are, I need to have, or penetrative sex, if they're a penetrative sex relationship, penetrative sex, I will have an orgasm with penetrative sex. So we work on that. Okay, so it's not what you see in Hollywood. Most people actually do not achieve orgasm in that way. So let's talk about other ways, or what kind of the norm, what I see as being more norm, rather than the Hollywood perception. Another common misconception, because I have a lot of fertility patients, so another common misconception, I need to have an orgasm in order to have conception happen, to conceive. And actually, that's a really interesting one, right? Like the contraction of the cervix and being able to kind of take the semen up into the uterus and up into the uterine tubes. So that's an interesting kind of misconception. I love talking about that. And then when people are at my table and I'm feeling the different tissue and energetics of the pelvic bowl, I'll get a lot of information. Heat, hypertonus, different muscles, the right or the left side being more of the female energetics, the male energetics of the right. That's how I see, and women will be talking to me and feeling, are they really in touch with this female side? And then, you know, if they are, because that's more of the intimacy side generally, I'll help them. I'll give some educational tools on how to really bring that side into more balance with the right, because a lot of women have right side strength and over strength. So.
Really liked all of that. I like the resources, for one, always knowing that there are other resources that people can access as well on their own time. And misconceptions is really interesting. I think we have a burning question over here.
Questions?
Questions. I'm curious to hear from you as well.
So yeah, like this is standing room only, so I think a lot of people have come here, you know, they expected to get this powerful topic, you know, illuminated. So, and I really appreciate that you people are very deep and thinking in terms of the connections and the relationships and everything. And so, I was just wondering if you all had thoughts about, you know, seeing this contextualized, the kind of the problems that have reflecting problems in relationships, and perhaps in terms of reflecting the challenges that really the race is going through, the whole society and races, in terms of some people would put it this way, and I'm interested in what you guys think about the redefinition of roles, you know, male and female roles, and the coming to fullness, perhaps, which involves us having to take on and address the other side, you know, what's conventionally thought of the other side, i.e. males having to look at their feminine side, women having to look at their male side. And so I'm wondering what your reflections, I'm sure you have some, on these subjects and this total contextualization of how it comes, you know, as it sort of ratchets down into these nitty-gritty questions that you all have been talking about too. So
just before you answer,
you get the question right.
We have about 15 minutes left, so maybe just so we can offer up a few more questions as well, just concise.
Go ahead and go with that one. You
Okay,
seem pretty
sure.
energized about
Yeah,
that.
I love working with all different sexual orientation, gender orientation, and so I really, when I speak to my colleagues, I make sure that we're all on the same page with how we define sex versus gender versus sexual orientation, because those are three totally separate things. The sex you were assigned at birth may be different than the gender that you feel inside, right? And so how you feel and what you think of yourself as is more a gender, and maybe there's no gender that person wants to be assigned with. Maybe it's gender neutral, or they, you know, so you want to find out kind of what their preference is. And then also sexual orientation is more their heart. I think about what the heart, what they desire within. And so if there's a sexual health concern in a relationship, are they with in a sexual orientation relationship that feels fulfilling to them? And is there something that's not being talked about or not being, do they feel like they're being suppressed inside of who they've been engaging with their sexual orientation? I like having that conversation.
Maybe we could do about 60 seconds from somebody else. Somebody want to jump on that?
You good? 60 seconds. Okay, so.
You can do 61.
Okay, so we as a society in the United States have swung so to patriarchal, matriarchal. We've been this pendulum, like this, swinging. We are, for the first time, finding balance as an American society. And so now we have confusion because women have become powerful, We're doctors, we're lawyers, we're politicians. And so men are somewhat confused and lost because women are wearing pants. And so we're, I mean, guys, we gotta laugh about it. So here we are in this place of men trying to figure out their role in society and in their relationship and even in the bedroom. And women are also confused as to, we now want to be young, we want to be masculine, we have forgotten how to receive and how to be receptive. And the way to empower your man is to receive him. If you don't receive him, he loses his power. And so here we are in this social dynamic of confusion because we may be born female but feel male inside. And so there's this whole societal confusion, and I talk about this a lot with my clients because a lot of my clients, the women, want to be sexually in control, and the men are losing interest. And so this is a huge issue of not just our sexuality, but our spirituality and our roles as a society. And now couples have to figure this out amongst themselves because we've written a new book.
Yep, we've got a question in the back.
Yeah.
If we can come back, maybe you can pick one of your other favorite questions. But we'll start with you.
Okay, you mentioned earlier, like, working with a teenager who has autism and wanting to date. Do you have a lot of experience with that? Like, a pre-teenager whose body is changing, but their mental capacity may be at an 8-year-old?
Personally working with it, not so much. Working with colleagues, we've talked to kind of, I have a couple colleagues that we get together and like within 2 minutes we're talking about sex and we're talking about intimacy and we're talking about relationships and everybody around us is just like, what's going on at this table? Because we'll go out to happy hour and then of course we have like all these other people joining in and wanting to learn and it's kind of interesting. So I have several colleagues who have experience with that. I think one of the biggest things is then really bringing in the parents and education. What is normal? And then also finding analogies or stories that can work and reach that educational level, that cognitive level for the individual going through body changes, for example. There's a concept of making the stories, the social stories.
Yeah.
Social stories are really, really, really important in that kind of context. Also, yeah, I'll just leave it at that. So that's one example.
Yeah, there are resources. There are a lot of resources for autistic teenage people, going
Yes.
through puberty. There's now even dating hotlines and books for autistic and mentally challenged prepubescent society. So there's a lot of resource now that there wasn't even 10 years ago.
Yeah, and Portland actually was a very thriving, very active community.
I work with early childhood, so I'm just curious what we
Got
could
it.
do to...
There's lots of books out there. Yeah.
And I did see a hand go up right over here.
Oh, yeah. While we're talking about this topic, on OPB there was a documentary on Independent Lens called Autism and Love, I believe. And it showcased 3 people, a couple, a young man, and an older gentleman, all talking about their relationship. So I highly recommend it, watching it.
Thank you.
Very relevant.
Thank you. Yeah.
Sarah, did you raise your hand?
Yeah, I did. This question is for Mary Dunlap. You had mentioned that you do work with the intravaginal pelvic floor massage. What is the typical reaction from your patients when you suggest that therapy would be beneficial, and then how do they react to the therapy?
Yeah. So most people have never had the therapy done, so I do explain that it's intravaginal, make sure they understand that I will be inserting a finger and assessing the muscles, I'll be assessing the energy, I'll be assessing the tissue, and it's and that they are completely in control of the therapy. So I make sure they really understand exactly what's about to happen before it happens, and then I'm really careful when we start the therapy, I don't go straight to that. We do an entire meditation exercise externally first. So I work externally first and make sure that they feel comfortable and relaxed on the table there. And I have my hand on their sacrum and I really see when they're giving me their weight and they feel relaxed. So it's very important for me to feel that before, that they're not pulling away, their sacrum isn't lifting off the table before. And I actually do a lot of Reiki on the table with these patients too. So I'm making sure that the energy is moving as much as I can get it to move with their help, and then we'll begin the intravaginal portion. But it's their entire body's covered, and the only time that I lift the sheet is when I insert my finger, and then the sheet goes back over, so that they're covered. They feel like they're covered the entire time, and that then they have their hand on top of their own lower abdomen, and I think that helps them feel like they have a sense of control over the session as well. So it's really, and then I have to make sure my energy is really clear with myself. So I have to very much be grounded. I have to be connecting my pelvic floor to the ground, to the earth, and I have them in the whole time pour their energy out into the earth. The earth is their holding space for that entire session. So when things come up, they go out. We create a meditation, some sort of visual meditation to the earth, and we get into that really quickly. So, and then people who have never had it often will walk out saying, wow, I did not realize how much I needed that kind of work. And just like, a lot of people don't think about getting an intravaginal, it's kind of like a massage, intravaginal massage, but it's pretty awesome. It's really interesting.
We do only have about 5 minutes left, so I did kind of want to open it up to you three, maybe for a closing statement. I know we have a lot of people in school right now to become practitioners of varying types, or already are practitioners, or just wanted to come and listen. Anything that you might want to say? I know that's really general.
I would just say that there's a ton of resource out there these days. So dive in, educate yourself, get to know yourself first. Really get to know your own sexuality and your own strength and your own challenges, and dive into that. You really have to be solid in yourself and your own sexuality before you can really tap into this with your other clients. So I absolutely love the Taoist practices. They're meditation, they're mechanical, they're scientific, they're mathematical. So look into, my main resource is a man named Montauk Chia. He's from Thailand. There is amazing resource out there. He's all over YouTube. You don't have to go to Thailand like I did anymore. He's free. He's on YouTube. I pay tons of money, but you don't. You know, it's available. So really, really dive into it. Don't be shy with yourself. You know, really dive into your own sexuality and the education that's available to you, because there's a lot out there now that really wasn't before.
Find good mentors, good mentors who are in the kind of the field of sexual health that you feel drawn to. And I tell students this when I'm teaching all the time. What are you passionate about? What gets you going and gets you up in the morning and makes you feel fulfilled at the end of the day? Because getting to know that is so crucial to not burning out in the medical field. Any sort of medical field practice, you're taking care of others, so you should make sure whatever you're doing is taking care of you. So just really making sure that you are doing exactly what you're passionate about, and then finding a mentor who moves you in some way and makes you feel excited and just, oh, I want to learn. So that's what I think. Look for good mentors, and then shadow them, and then figure out ways to augment your education. So whatever that is, through that mentor or through all the other tools.
I think that the big thing, know yourself. Know yourself. If you've experienced any kind of trauma, come to terms, work with your own trauma before you try to work with clients with a potentially traumatic situation for themselves. Practice self-care, have really good boundaries, and I think be prepared for the totally unexpected. Because, I mean, I could tell stories about people have said certain things, and I'm just having to be like, oh, okay. So, tell me about this. And on the inside, I'm like, we're in the middle of a group, totally about like budgeting. This has nothing to do with this. And yet, on the outside, I'm really wanting to validate that, oh, this is happening. Okay, and this is really something for you. This isn't really the most appropriate time to talk about this, but I want to hear what's going on. Can we check in after the group? And so finding ways to be available, but also really protect yourself. And if you're in a group about budgeting or whatever else you might be doing, protect those around you and that person as well. Help give them a safe space.
And again, yeah, self-care. Self-care is huge.
Self-care.
Self-care is really huge. Yeah, take care of yourself. Cultivate your own power.
I think that was really dynamic, and it was interesting hearing different perspectives from all of you, and thank you.
Yeah. If any of you want to speak to us, to me privately, if you want resources, books, authors, feel free to come up here and talk to me.
Nice, awesome. And then one more announcement, just from SAME. So at 7 o'clock will be the school panel discussion. So all of the ones who submitted different videos are going to be talking.